Thank you for tuning in to another episode of Help Nobody Told Me. I'm Jasmine Shapiro. I'm with Berkshire Hathaway Home Services here in the Chicagoland area. Here with my co-host Mindy Leonard with SOS Super Organized Spaces.
So happy to be here with you always, Jasmine. And we are so happy that we get you back.
Yeah.
This is Dr. Suzi Siegel. Dr. Suzi was a ER doctor for many years, continues to be an ER doctor, and is now dividing her time and also as a menopause specialist. And what a thrill to have you back. Thank you so much for joining us again.
I'm excited to continue our conversation.
Yeah. We had you last week with part 1, and now we're going to continue the conversation because so many women and men out there want to understand what's going on, and it's really, this topic is just coming to the forefront, right?
Yes.
And I'm
very
thinking
exciting.
we have 2 episodes, but we could probably do 26 episodes with
I could
you.
talk for like a million hours about this. So.
Right. So who knows if we need
so many things to talk about.
So many things to talk about. But
if listeners did not hear last week's episode, just give a little overview of your background.
So a little about me. I'm board certified emergency medicine. I worked in busy ERs for decades, and I recently opened a concierge practice focusing on midlife women's health, perimenopause, menopause, and it's because it's a full body experience. And I really want to sit down with women and educate them and make sure they know their options, make sure they understand what's happening to their bodies and what they can do to protect themselves now and the rest of their lives.
And your office is in the northern suburbs of Chicago.
Yes.
We just want to say that for anybody who's wondering.
I'm my office is in the northern suburbs of Chicago, but I'm licensed in Illinois and Wisconsin. So if someone's in Wisconsin, they can see me. I also can do telemedicine. I prefer in person, but I do telemedicine also if someone's a little far away.
That is good to know. The other thing I think we just want to very quickly clarify, can you talk about, again, just what is the difference between perimenopause and menopause, so everybody's on the same page.
Right, the 3 P. So with menopause, by definition, is you've outlived your ovarian function. So for the average age in the United States for women is 51, but some women go through earlier menopause. Let's say someone has a surgical menopause at the age of 35. They're in menopause at that age. Perimenopause is the time leading up to that when you have massive hormonal fluctuations, and that can last 4 to 10 years. So women in their 30s, early 40s might be experiencing symptoms. They don't contribute to the hormonal changes. They feel like they're too young.
So talk about those symptoms that could start in your 30s.
So the first hormone that tends to drop is progesterone. And when you think about progesterone, you kind of think it as the brain hormone that works on the GABA receptors. And that's when you start seeing the mood changes. So some of the first symptoms women will experience are mood, feeling anxious, depressed, irritable, brain fog, trouble sleeping. That's often more progesterone. And then you start having the estrogen changes, and that's, people kind of think about hot flashes, night sweats being the stereotypical menopause symptoms, which they are the stereotypical. But people don't realize that estrogen is everywhere throughout our bodies, from our brain down to our toes. So the first symptoms start in the brain: trouble sleeping, trouble focusing, the brain fog, mood changes. And then as you go down, some women can experience frozen shoulders, some women can experience palpitations, someone can have itching on their ears, dry skin, hair changes, recurrent urinary infections. It happens everywhere. So there can be all sorts of different changes throughout as you start getting through this.
Do men have estrogen too?
Men have estrogen too. Actually, men have more estrogen than women as you get older.
Oh, really?
And women have testosterone. So these are full body hormones. These are not just female or male. That everyone has them, just in different concentrations.
Okay, and we lose it because we are no longer going to have babies. Is
Right.
that right?
Correct. So
Okay.
actually, we don't lose testosterone the same way. So testosterone starts dropping in our 30s. And that's a steady, it's a podcast just so we can see my hands, but that's more of a steady decline. That doesn't just suddenly drop off during menopause as the estrogen and progesterone does.
Okay. Interesting. So people who say that we are crazy because our moods are all over the place, but we're really suffering.
You are really suffering. And you think about, we gave the analogy the last podcast about puberty. I mean, you think about how you may not remember how you felt going through puberty. You might have chosen to forget about it, but you think about your kids, it's a hormonal roller coaster, and you don't know what to expect, and things are popping up, your body's changing, you don't know what the heck is going on. Although in puberty, we tend to give more information to people. In perimenopause, we really are not educated well enough. And just understanding that you're not going crazy and what is happening to your body is real is so helpful.
It's nice to have that confirmation.
It's validation.
It is total validation.
Actually, one of my favorite menopause podcasts, their tagline is, "You are not going crazy. This is really happening to you."
Yeah, that's good.
Mm-hmm.
Well, can we talk about the big question that I think so many women have, and that is hormone therapy.
Mm-hmm.
And a lot of women are scared of hormone therapy. And can you talk about that? What is the big scare out there, and is it factual, and what is the truth behind hormone therapy?
Yeah, so
Okay.
whatever fear there is about hormone therapy comes from a study called the Women's Health Initiative study that was published in 2002. They ended it early, and there are a few people on the study that said they made a big press release announcement saying this is not safe for women. It can cause breast cancer, heart attacks, and strokes. And now 25 years later, and reanalyzing the data and all the information we have, they misinterpreted the data and it was incorrect. And that if any issues happen, they think it was from one of the formulations they use. So everyone in the study had the same dose of everything. They used synthetic hormones, the synthetic progestogen, which we don't use anymore. They think that was linked to some cases of breast cancer. And the estrogen they used was equine estrogen, so it was horse pee. So horse pee, I mean, when you talk about people wanting to be natural, like
Right.
there's nothing more natural than horse pee, right?
Yes.
But it's not really what's in our bodies.
Right.
And they're all different things. So that still exists, but we just don't use those formulations anymore. We tend to use bioidentical. What that really means is the chemical structures that your body is used to seeing. And it was also the average age in those was much older than the age we start women in now. So what we learned from all that is that the safest time to start hormone therapy is at the onset of symptoms.
So like in your 30s? Like
No,
in your
but it's just in
perimenopause?
perimenopause when you start getting symptomatic.
Okay.
And through earlier side, it's more protective. It's anti-inflammatory. It's protective. So if you started, later, it may not have as much protection because it's really meant to prevent certain things. It can still treat some things, but it won't prevent other things because the disease has already happened for heart disease and strokes, things like that. So it's
when
extremely
should you
safe.
start noticing like the symptoms that you need to then treat them? So is it the brain fog? Is it the night sweats? Like which are the ones where you have to
Yes.
say, okay,
Yes.
you need to get
All of it.
All of it.
All of
And it
it.
depends
But you may
what's
not
in-
notice, like
right,
you
people
said.
don't notice.
I think that's a big
People don't
problem.
know.
If
People don't know.
or looking back, they would say, "Oh yeah, I was experiencing
right,
it." But
right.
kind of when you're
And
so busy
not
with your life.
everything's hormonal. Some people come to me and say, I want hormones because of X, Y, Z, and I go through everything with them, and I'll say, you know what? I don't think that's necessarily hormonal with you. It might be contributing, but your main issue is something else.
Mm-hmm.
So it's important not to blame everything on the hormones either. But the best time to start treatment is when people start experiencing symptoms because it can really be protective. And the earlier you start, the more protection you have. It doesn't mean you can't start it later, but the safest window is the earliest onset of menopause symptoms and within that 10-year period of going through menopause.
And so how long do you stay on?
You
the
can
hormone?
stay on it as long as it's safe to do so for you. So it's a continuous conversation with people. I would say I would want someone to see me at least once a year and reevaluate every year and make sure you don't suddenly have a contraindication. There are also different formulations. So what's the safest formulation for you at that time? Have your goals changed? Has your health history changed? So you can stay on it forever. I would say every menopause specialist I know has no intention of ever stopping it.
Okay.
And some forms are safe to start even later. For example, vaginal estrogen is not absorbed through your body systemically. It just stays local. You could start that on a 90-year-old nun. It's perfectly safe. So all these women, one thing as an ER doctor that would just, it was so frustrating. You'd see all these older women coming in with urinary tract infections that would turn into urosepsis. They'd be in the ICU suffering and sometimes die. And by giving vaginal estrogen, you can reduce that by half.
Wow.
So just think about
It's
that.
incredible. I know so many older women who suffer from UTIs, and they are so dangerous. It's much
So
different
dangerous.
than somebody in their 20s getting a UTI. It's a completely different.
And it's
I mean-
so easy to treat. It's so easy. It's so easy. You just give vaginal estrogen. And it's also, you said UTIs in younger women. There are also low hormonal states, for example, postpartum. So you have that drop in hormones postpartum, and women at that point can have symptoms too. They can also have local vaginal estrogen, which will help a lot.
Okay, so in our previous episode, I was getting all excited with our conversation, and I was asking you about all the different delivery methods, which we want to hold off and talk about now. So now, can you talk about that? You mentioned the vaginal, but what other ways are there?
Lots of options.
Okay.
So don't ever, if someone tries to get help, just make sure if someone says, I think you should take this, always ask, what are my other options? There are always options. So there are pills, there are patches, there are creams, there are gels, there are vaginal rings, lots of options.
And how do you determine the right option for your patients?
So some of it is lifestyle, some of it is other health factors. For example, so taking estrogen by mouth, it gets metabolized through the liver. So that can give you a slight increased risk for a blood clot. So with younger women, it's usually fine. For an older woman, like a 6-year-old woman, I'm going to say, I don't want to use oral, estrogen on you. I want to just use the transdermal through the skin where it gets immediately put into your bloodstream.
A patch, right?
Right. So, and then patches and gels and sprays that are topical. Some women who have really sensitive skin, like someone with psoriasis or allergic to adhesives, patches not going to be good for them. They should have the gel. The patches are once a week or twice a week. Gels are daily. Some women like the daily applications. Some women will forget and don't. A ring you can put in that's kind of set it and forget it. That might be easier for some people. So it really depends what they want, and you're not married to it forever. You can try one and switch it to something else and just decide what's best for you.
And so I know that you're a big proponent of, let's manage the symptoms.
Mm-hmm.
So have you ever had a client come and, you start with one thing and all of a sudden lifestyle, whatever, or age,
Yes.
it changed, and now we need to switch?
Yes, and it changes. So especially with perimenopause, when someone's in menopause and the hormone levels are flat, it's easier. When you're in perimenopause and things are all wackadoodle, high, low, going all over, that takes a lot more troubleshooting. And there are other issues. Some women in perimenopause might start getting very heavy bleeds, and then you need to go not just on hormone replacement, you kind of need to go on birth control pills or that type of thing that are much higher dosing to shut it down and stop the bleeding. So it really depends on the person's situation at that time.
Sure.
And potential side effects of medications, how they feel on them. So it really depends on their unique needs, if they still need birth control or not. One thing with perimenopause, people have to remember, you're not done. There's still a risk for pregnancy until you're fully in menopause.
Is there any correlation to if somebody had horribly heavy periods or very, very painful cramps? Is there any correlation to those experiences and then how they may experience symptoms in perimenopause or menopause?
Yeah, that's a really great question. I ask people that because yes, there is. So people have had, yes, there's definitely correlation. There's also correlation with mental health. So if someone had postpartum depression or really bad mood changes during their periods, then they're more likely to have it in perimenopause also. So
That's
it's
fascinating.
So I always ask about that, and I'm extra sensitive with that to people.
What about what age their mother went through menopause?
It can be,
Yeah?
yes. So it tends, things kind of run in families. So if your mom went through it earlier or later, it can be. Mm-hmm. Yes.
And what about genetic, bone issues or,
Yes.
osteopenia,
Yeah.
or any of that?
Genetics are about 20% of everything overall with our health, but it is. And it's also body composition. If you're a tiny Asian woman, you're more likely to have osteoporosis than a heavier, larger woman. So Yeah, definitely.
And will the weightlifting, will that help with that?
Absolutely. Absolutely. I mean, there's so many cases where people started strength training and went on estrogen. Estrogen is protective for bones, but it's not just the only thing. You can't just take estrogen and expect your bones.
Right.
And you can see improvement, but you really have to do the impact training and building muscle. And you're not going to bulk up. It's just having the muscle strength because you're losing the muscle strength.
Right.
So I want women to stop thinking they have to be skinny. No one, you want to be strong. You want to be strong.
Yeah, it's so important.
So
And
important.
also eat healthy, right? Nutrition.
100%. Nutrition is, I'm always food first. Food first, eat everything. Eat what you need to take. You have to supplement a few things. I'm not a big supplement person. I always try whatever you can eat, get it through your diet first. It's always better that way.
Mm-hmm.
Calcium is better absorbed through your diet. Fiber is better through your diet. All the minerals, it's always better through a whole food diet.
So you talk about the importance of bone and muscle. And I know there are scans that we can get to see if we have osteoporosis and that kind of thing. Mm-hmm. Are there scans for your muscles to see?
Yes,
where
there are.
at?
There are body composition scales. So I think, when people try to weigh themselves, it's not just your weight, because that's just one measure. It's really how much of that weight is muscle and how much of the weight is fat. And it's really exciting when you see the changes. When people start doing the strength training and building muscle, and their weight might stay the same.
Or it could even go up.
And it can even go up because they're building the muscle.
And muscle weighs more.
Yeah.
And muscle weighs more.
Right.
So a lot of people on weight loss medications and all that, they're losing weight, but they're losing muscle. And that's not good. Metabolically, that's not healthy. You want to gain the muscle. So that's one parameter. And as far as checking your bone health, it's called a DEXA scan. Mm-hmm. And there are two types of DEXA scans. There's the hospital grade DEXA scan, and that's ultimately really the better one if you really need to know about true bone health, because it doesn't just say there are scores and blah blah blah, but it also tells you the health of the bone itself. Where you can get a less expensive scan, a DEXA scan that has the body composition with it, but it doesn't really tell you the full bone health. So it's fine for screening, but if someone really is worried about osteoporosis or monitoring that or deciding other medications for bone loss, you need a hospital grade study.
And who prescribes that for you? I know that's something you could do, but in general, if somebody doesn't have a specialist like you
can get it yourself. The hospital grade, they often want to send it a report to a doctor, but you can always just ask for yourself. The body compositions you just can do yourself. A lot of gyms have the in-body scans, which is nice. It won't have the DEXA component, but it'll do body composition. But you can get an order from your primary doctor, really anyone. Mm-hmm. And you can also, sometimes, some places won't require an order from a physician.
Interesting.
Yeah.
Okay.
Mm-hmm.
All right. Good to know.
So we talk about, on social media, you're hearing so much now. We never heard anything about menopause, and now we're hearing a lot. How do you know what's true and what's not?
Well, I know it's hard.
You know, because you
it's hard. I
researched,
know,
right?
but I would say always with a grain of salt what you're listening to. There's certain people I would definitely recommend. Make sure you read their bio a little bit and they're not just trying to sell you something.
Right.
So if they really are giving you information and it's research based, by all means.
And you have some resources on your website
yes,
too,
my
right?
website, I have some resources. You can always go to the Menopause Society website. They will always have, that's the best resource right there. Some people I would recommend that give great information. Dr. Heather Hirsch, Dr. Mary Claire Haver, Dr. Clay Casperson. Oh my gosh, there's so many. I should have made a list with me.
That's okay. I mean, that's great to have a few.
Yeah, Dr. Vonda Wright. So these are all they give great information. Yeah.
So just beware, just like everything else. Beware
like
what
everything
you
else.
read.
And beware too when the catch is if you ever see ad on there or they're trying to sell you something, just just be careful what they're saying.
So when you are treating somebody who is going through menopause or experiencing all these symptoms, it doesn't sound like it's a one-size-fits-all solution.
Not at all. Not at all. Everyone's different. Everyone's their own person with their own unique background, their own medical history, their own expectations, their own goals. So everyone's different.
And I think going back to that, that's why people were really upset after the study came out and the estrogen. It was just like one way of treating.
Right, but that's all we had then.
Right,
now
but I
we have
think
so
that's what
many
people
options.
got very
Yeah.
anti as well. Now there's so many options out there.
Yes.
Yeah.
And I would also say, make sure when you see somebody, make sure they make sure they give you the options. If they only know one way to do something, that's not good.
Yeah.
I like your advice of saying, well, okay, somebody recommends this, and you, as the patient, say, what are my other options?
Right.
Because we all need to be educated, and we all need to be our best advocates.
For sure.
But
I have some people come to me, I just want the patch because I heard the patch is great. I'm like,
Right.
okay, I'm going to tell you about the patch, but I'm going to tell you your other options. And sometimes I don't want to hear them. Like, no, I have to tell you. And now, because of all this renewed interest, there's a shortage of patches right now.
Oh, really?
Yes.
Huh.
So what I've been advising people is there are other options. We can try a gel, a spray. We can try different things. And just for if people are having trouble finding the patches, just call around to different pharmacies and someone will have it somewhere. But there are other options.
Interesting.
very interesting.
So what about a woman who doesn't want to take or can't take hormones?
So that's why we really double down on lifestyle, because lifestyle is the heart of everything. It's how we move our bodies, how we fuel our bodies, the proper nutrition, how we rest our bodies, making sure we're getting adequate sleep, social interactions with people, and just how you live your day-to-day life, your daily habits. That is crucial. Because if someone just wants to take a pill, it's not going to take care of everything. You have to do everything with it. Right. It's all together. It's all together. I give the analogy of a cupcake. So the cake part itself is lifestyle medicine. How we sleep, how we move, how we interact, I'm missing the other ones. And then the hormones are the frosting, and the supplements are the sprinkles.
Oh,
so you have to have the base.
Yeah, I love that.
That is good.
Yeah.
Although some people do just like the frosting and they don't even want the cake.
True, and I don't like the easy ones. Some people just give me this. Like, no, you have to do the others.
Right.
You have to.
Mm-hmm.
Right. What is your goal? Do you want to live a long, healthy life?
And it's healthy. You
Right.
don't want to be the older woman who falls and breaks her hip.
Right.
You don't.
Right.
I like how you keep saying that taking the hormones is preventative and protective.
It's preventative and protective.
And those are words that I have never heard being associated with them because of that study and because of the scare that's been out there. Mm-hmm. And now it's been proven the opposite, that it is actually preventative and protective, and the earlier that you start, the better. But there's really no time where it's too late.
Well, for systemic hormones, you won't have that. If you start it later, or if someone has a lot of medical conditions that might be contraindicated, then you don't. But
Right.
But it's never. If you have a 70-year-old who has no cardiovascular risk factors and she's great and she's still having hot flashes, about 10% of women will have hot flashes forever, and her quality of life is really suffering. You weigh things. It's like, okay, my quality of life is so bad. I'm not sleeping because I'm having hot flashes and all this. Then you have a discussion with risk-benefit ratio and decide what she decides. She's the CEO of her body. She gets to decide.
Ooh,
and
that's
I
a good
advise
one.
her if I think it's wise or not.
The CEO of your body.
Everyone's a CEO of their
Imagine
body.
if everybody started treating themselves that way.
I know.
And asking questions the way they would if they were the CEO.
Everyone should be informed. Everyone should take charge.
And I know we brought this up in the first episode, but sometimes people will say, well, my doctor told me my labs are normal.
Yes, that's one of the biggest myths. So your labs can be normal, and you can. But if your labs are normal, and you're telling me I'm waking up every night, every couple hours, I'm having hot flashes, and I wake up soaking wet, I'm having brain fog during the day, I'm having all these other symptoms. I'm not going to say, well, your labs are normal, I'm not treating you. If you're 49 years old and you're having all these symptoms, you're in perimenopause.
Right.
And your labs on a Thursday at 4 could be high, and your labs on a Tuesday at 2 could be low. So it's really no point in checking hormones at that phase. I check hormones for specific reasons. I think one thing, if it's another thing, what to look for if someone's just saying, let's order 1 million labs and optimize everything. That's not really how it works. Your hormones, just think about your normal menstrual cycle. Your hormones are fluctuating all the time. So there are only certain situations where you really want to check levels.
Yeah.
Only check things where it's going to be helpful and guide you properly.
But what do you do if your doctor says, well, your labs are all normal? Like, what do you do then? Reach out to you and just say,
Reach out to someone who
I'm so
understands
frustrated because
it.
I still don't feel right.
Right.
I'm still waking up. I'm still,
Yes.
Okay.
Yes. Reach out to someone who has the extra training in menopause care. And again, a lot of the doctors don't know.
Yeah.
I think
we're
we're getting
trained.
better, but it's still new. People
So
don't
back
know.
to your point, be your own advocate.
Right.
Be your
So
own
what are
advocate.
the top complaints that women come to you with?
Sleep.
Okay.
I can't sleep. My mood. Weight. Things I look in the mirror, I don't recognize myself anymore. I don't feel like myself at all. Hot flashes. Hot flashes and night sweats less because I think people coming to me have done their research and they kind of know. It's more the subtle things. Joint pain.
You mentioned frozen shoulder. I had no idea that was.
I didn't either.
Yes.
I had frozen
Oh,
shoulder.
And how
really?
old were you when it happened?
It was
40s, 50s?
It was in my 50s.
Yep.
Yeah.
Yep.
I had no idea. I
I
had
had
friends
no
who
idea
have had that.
either.
Yep.
And what's the correlation there?
Hormones.
It is. Duh.
You cannot blame hormones on everything.
Yeah.
But why is it predominantly women 40s to 60? There's a hormonal component to it.
Yeah.
Again, it's not just 100%, but there's a component to it.
Right.
Yep.
But you go see like a bone doctor and they want to just inject you or give you.
And that helps, right?
Right.
But that's the one thing with Dr. Von der Wright. She's an orthopedist, and she's all this about
How the hormones affects all of it.
Right.
And she coined the term musculoskeletal syndrome of menopause because you have women that are getting diagnosed with fibromyalgia. What is that? It's probably hormonal. You're having joint pain everywhere. I've had women come to me that have arthritis and then they go on hormones and they feel so much better. They have less joint pain. Again, it's not like the magic for everything, but it can be so helpful for so many things.
Well, I think so many things are tied to hormones that we didn't know were tied to hormones, and I would think the average woman wouldn't know that they were tied to
But
hormones.
the doctors didn't know back then is what you're saying
Right.
too. Like this is now
There wasn't the
coming
training.
to the forefront.
And thank goodness there are people like
I
you
know.
who had the light bulb moment or moments to
Right.
say, you know what, this is a real issue.
Yeah.
And thank you for doing what you're doing and coming on
Yeah.
and sharing this.
It's an exciting time, and there's so much information coming out. I would just recommend everyone just educate yourselves, read what you can. If your doctor's not on board or doesn't understand, educate them.
Yep.
Yeah.
All right.
Well, should we do the lightning
yes,
round?
I think so.
Okay.
All
All
right,
right.
I'm ready.
Are you ready? Okay. I'll go first.
Go ahead.
Okay. Tell us, what is the biggest myth about hormone therapy?
Oh, there's so many myths about hormone therapy. I think one of the biggest is that you're too young or too old to start.
All right. Most misunderstood menopause symptom.
Most misunderstood menopause, probably mood. I think people don't recognize the mood component.
One thing women over 40 need more of.
Protein
Protein.
and strength training.
Okay, that's two things, but we'll take it.
And what's one thing women over 40 need less of?
People telling you what to do.
I love that.
I think every woman would say that, right? Like, okay.
Unless it's me telling them what to do.
Right.
For
Only listen
sure.
to you. Dr. Suzi knows it. Most common symptom women don't connect. Most common symptom women don't connect to hormones. Sorry.
I think one of them is palpitations, heart palpitations. I think people recognize the brain symptoms, brain fog, and I think people are starting to understand joint, but I think palpitations people don't realize.
Okay.
Okay, what's one wellness trend women should stop wasting money on?
Don't over supplement. Don't
Yeah.
over supplement.
Okay.
Plant diet first, food
Okay.
first.
I like that. Yeah, me too. What is the best stress reliever during menopause?
sex, but people have pain with sex sometimes, so that's why they need some help down there too.
Okay.
Most empowering thing women can do for themselves during this phase.
Educate yourself.
I had a feeling that would be your answer.
Yeah.
Education's key. And sometimes just knowing what's happening and knowing this is really happening, you understand what's happening, you can accept it a lot better.
You know, I'm suddenly picturing when my kids were in junior high school, and we would have these nights. So it would be like mother, daughter go to talk about puberty, father, son
Yes.
to talk about puberty
Yep.
and those changes. It's like women need these now.
They need them now.
Right? We need these now.
And you
Or we
are
could-
doing that, which we're so grateful
Which is
for.
fantastic.
Yes.
You just have to know.
Yes.
Yes.
Last question. What gives you hope about the future of women's health care?
That women are advocating for themselves, and we're finally getting research money and doing the studies, and you've got people that are loud and not accepting it.
I love it.
Yeah, it's great.
Thank
It's
you
great.
so much
Thanks for having
coming
me.
on. I know we're going to want to have you again.
I would love
as
to.
more information comes available.
It's coming out every day. There's
Yep.
more information every day.
Yep.
Meds all the time.
I mean, you
There's
had
so
said
much
before
going
you
on.
could do a whole episode on sleep. You could do a whole episode on bones. You could do a
Yeah.
whole episode. I mean, there's so
so much
much
to talk
information. So who knows? We might do that. But
Yes. We
we
will-
have learned so much.
We
This
have.
has been great.
And for our listeners and our viewers, we will attach all your contact information
Thank you.
to the show notes.
Thank you.
You have a website.
Yes, so Menopause Matters MD.com. So I have a resource section on there. I would be happy to see anybody.
Love it. Well, thank you so much,
Thank
Dr.
you.
Suzi.
Thanks for
And
having
thank you
me.
for tuning in. And if this episode resonates with you or you want to share it with anybody, please do. We have a new website out, helpnobodytoldme.com. And we hope you tune in next week for another episode of Help Nobody Told Me.
Nobody told me.